June is Men's Health Month, and this morning we're talking about a serious issue affecting a lot of men. It's an issue that they also may be afraid to talk about: erectile dysfunction and performance anxiety. This morning we've got Dr. Eileen Palace, the director of the Center for Sexual Health, be here to talk about some of the causes, some of the treatment options. So let's dive right in.
Good morning, Brianna.
Good morning. Let's tell us a little bit more what ED is.
ED, erectile dysfunction, is a difficulty achieving or maintaining an erection satisfactory for sexual intercourse. And we usually think of that as something that's really common in older men, and people don't worry about it too long, but in fact, it's now 26% of men under 40 are experiencing ED, and 50% of those have actually a serious condition. So it's become much more common than people are aware of.
Yeah, that is a pretty staggering statistic there when you're talking about under 40. What are some of the causes of ED?
The physical ones everybody knows. There's physical and there's psychological. The physical ones are any cardiovascular disorder that's going to affect blood flow, obviously. Diabetes, prostate cancer, neurological issues, pharmaceutical issues, antidepressants, blood pressure medications. I mean, there's a lot of those kinds of issues. So any kind of accidents you may have had, so there's a lot of reasons.
Yeah. Okay. Yeah, there are a lot there. I think that probably people aren't, really aware of.
The psychological ones. Yeah.
The psychological, especially for like performance anxiety.
The psychological one's the one I really want to talk about, because I do this many times a week, actually. Men are very concerned when their MD refers them to a psychologist. Says, "What? You think it's all in my head?" Well, not exactly. Psychological causes are extraordinarily common. In fact, they're becoming the most common reason that men are having these kinds of issues, and it has to do with the way they're talking to themselves. Your brain, think about it for a sec, your brain runs your body, right? And your cognitions, that is your thoughts, are what triggers your body to run the rest of your physiology. So what you're saying to yourself in your head is what's actually causing the ED in many, many, many cases. Okay,
so the brain there does play a big part, right?
Huge.
And how does, you're mentioning that, but obviously it would cause worry, it would cause anxiety, and that's, you're saying, going to then cause the issue to be worse.
Right, we call it performance pressure or performance anxiety. It's a major cause of sexual dysfunction of men and women, actually. And that is the things you say to yourself in your head: worry, anxiety, fears, distraction, performance pressure. You say, what do men say? They know what they're saying as they're listening to me. What if this doesn't work this time? What if she's disappointed? What if she thinks I'm not attracted to her? What if I can't do this? What if I can't, get her pregnant? And these kinds of thoughts, that's all it takes. That's all it takes. Bam, your brain goes, oh, I'm not paying attention to what I'm enjoying and what's pleasurable to me. I'm paying attention to worrying about that I can't do it. What happens if you lay down at night and you think, I'm going to go to sleep, I got to get up and do a presentation in 2 hours. Are you going to sleep?
Probably not.
No, you're not.
And
the same thing happens with sex. As soon as you put that pressure on yourself, your brain shuts it off, and it's all over. You're not going to be able to achieve this.
So the thing that I'm sure a lot of men now listening to, what are some of those ways, the cognitive behavior changes, things that can help?
Well, everybody goes, well, I can't just stop thinking about it, right? You can't just say, I'm not going to think about the pink elephant in the room. All you can think about is the pink elephant in the room. So, unfortunately, we do have some very effective, it's called cognitive behavioral techniques. We call it cognitive restructuring. We need to do two things. We need to get rid of those performance pressures. That is, the things that you're saying to yourself about yourself and your body have to go. We also have to decrease the sympathetic activity, that is your fight and flight mechanism, because you're too anxious to be having sex and your body's closing down those blood vessels and not letting the blood flow go there. So we do cognitive restructuring, which gets rid of those unrealistic, we call them catastrophic, automatic thoughts of what if, can I, what, when, should I, how. You get rid of that, and we rewrite that by doing sensate focus exercises. We do cognitive restructuring, which we take the things you're saying to yourself, like I'm going to fail this time, it's a big one, and then you rewrite them into something more realistic, because that's not true. And then when you relearn to put those things into more realistic kinds of self-statements, you talk to yourself differently. Your body doesn't respond with that sympathetic activity. It doesn't shut down. It doesn't cut off the blood, and everything works just fine. But it takes practice. This doesn't happen in one trial. It takes time to relearn that.
And you are someone who can help them with that practice. We've got Dr. Palace available. Thank you again for coming in to help about those, not only for men's sexual health issues, but also women. We have a link to her website on our website, WLTV.com. Just look under the links tab.